Hi, my name is Hannah Mosier, and this past week I had the opportunity to shadow Mackenzie Mangles, who is a physical therapist on the cardiovascular ICU team. And it was a really cool experience because prior to deciding on nursing, I considered going and being a physical therapist. So it was really cool to see that that could have been something that I did. And it's still something that I think is really cool, especially because they play such a vital role in patient outcomes. So basically, our day started out by we just talked to a lot of the other physical therapists on the team. She said that there are about 100 on the cardio team, which I was really shocked that there were that many. But then again, UK is a huge hospital. And they basically divided up patients and figured out who was doing what. And then we actually started our day rounding with an occupational therapist, which I thought was really cool because they said that whenever they get a new patient that they typically do their initial assessments together because there's a lot of overlap and so they don't want to bother the patient, which I can respect. So we actually kept going back and forth between PAV A and PAV H. So I thought that that was cool too because I expected kind of like nursing that it would just be kind of like a confined area and that they would just be on like one side, but their patients were all over the hospital. So one thing that really shocked me is when we went into the patient's room, she did a basic assessment, minus all of the vitals, but she really was focused on a lot of psychosocial concerns, which I did not think of as being as important as they are, but she assessed the room, the safety, and asked a lot about the patient's home and their home life and whether they have a spouse or children or animals, pets, and the amount of stairs, which I did not think that that would be such a big issue, especially because some of the patients were only in their 30s and 40s. So I did not think that stairs would be as big of a complication, but she explained that it can put patients at a huge risk for post-op complications if their home is not one level or if it is not as safe as it can be. And throughout my experience, I did observe many nurses, and it was actually really cool because for one of the patients, we had to push his IV bag, and he had to have monitors on him at all times because he was very, very unstable. And so they actually had the nurse and the tech. One of them was pushing the pole that had all of the IVs and the antibiotics, and then the other one was pushing a chair behind while they had the physical therapist on one side and then the occupational therapist was on the other. And so I thought that that was really cool to see the collaboration between not only the physical therapist and the occupational therapist, but also the nursing assistant and the nurse, because I mean, that was a team of 4 people. And she explained that that's actually very common for there to be a lot of people because it's not possible to move a lot of these ICU patients and to get them up and moving without multiple people. But she explained the importance of communication and collaborating and making sure that she's on the same schedule as the nurses so that she can use them to her benefit when she needs it, because she said that a lot of her patients she could not go in and do a solo. So I thought that that was really, really cool, but I also found it really fascinating that for them to get paid, they have to spend X amount of time with each patient. And they have to, she explained that it's each point, so they need 12 points total, and each point is like 15 minutes, which she said working on the ICU that it's not a problem at all, and that this is not necessarily for all physical therapists, but just for her unit and everything that they need 12 in order to get paid for that day, which I thought was interesting because I had never considered. I thought that it was just a job. You show up, you do as much as you can. And so I thought that that was interesting because I know that patients on my floor that they've refused physical therapy before, and I did not realize that their refusal is impacting the physical therapist's pay. So overall, the experience was a really positive one, and one that I'm glad that I had the opportunity to experience because I think it changed my outlook on physical therapy and just a whole new level of appreciation for everything that they do, because I think that they do a lot more than what I previously thought, and especially like their ability to try to synchronize their schedules when they have patients all over the hospital. That requires a lot of thought and a lot of time management. And so it was really, really cool to see all of the pieces working together.